Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. You know, a lot of us suffer from headaches in one form or another. Some of them are caused by stress, maybe possible injuries, and some of us get that migraine that so many people talk about. Our guest is Dr. Alan Rapoport. He's a Santa Monica, California neurologist, and he's joining us on the program today to discuss various types of headaches and how GammaCore can possibly help some of the discomfort and pain associated with these varying types of headaches. Welcome to the program, and thank you so much for joining us, Dr. Alan Rapoport.
Thank you.
So give us a bit of background about yourself. You're a neurologist. What led you to the field of neurology?
I've always been interested in the brain, and as a high school student, I got very excited about the brain and the nervous system. And many years later, I finally became a neurologist, very interested in helping people with brain disorders. And over a period of about 7 years after having gone into practice in Connecticut, I seemed to gravitate to people who were having head pain, face pain, neck pain. And the interesting thing about migraine and cluster headache is in between the headaches, the people are actually just fine. But during the headache, they're in bed or banging their head against the wall. And then again, they're fine the next day or an hour later. And I really found that fascinating. And as I looked into it as a neurologist, I saw many years ago, there were very few good medications and devices to help people with that kind of pain. And I wanted to get into the field so I could work on that situation. And over the last many years, I've helped to develop many of the drugs and devices that are currently available in headaches. So it turned out that I think I did a good thing, and my patients are very happy about that.
Right. Now, you mentioned severe headaches, pain that causes, as you said, one to bang their head against the wall while they're going through it. What is the difference between, your regular run-of-the-mill headache that, we talk about the tension headache, a migraine, and what you mentioned earlier, a cluster headache? That's a term I'm not familiar with.
Right. Well, there are 4 types of headaches that are the most common. What most of your audience really knows as a headache is a mild headache on both sides of the head that lasts for a few hours, might be due to stress, might be due to not sleeping well enough, and eventually it goes away, and sometimes aspirin or an anti-inflammatory or just getting away from the boss or going for a jog can take care of it. That's the most common type of headache. That's called a tension type headache, and it's almost never caused by anything more serious. The next most common is a migraine. About 13% of our population has migraine. Interestingly, 3 times more in women than men, although children have about the same. And migraine is caused by some inflammation in the covering of the brain. It's sometimes related to blood vessels in the head. And it's a headache that, for most people, occurs 1 to 3 times a month. It's very severe. It's often one-sided throbbing with nausea and vomiting and light and sound sensitivity and a lot of disability. Very different from a tension-type headache. And we have good acute treatments for it to knock out a headache that occurs right now. And we have somewhat reasonable preventive medicines that you can take every day if you have enough of those headaches or if they're severe enough. Now, cluster headache is probably even worse, but it's not as common. So whereas migraine occurs in 13% of the population, cluster headache occurs in less than 0.1% of the population. So much fewer people. And interestingly, it occurs more in men than women. And a cluster headache is much shorter. I didn't mention that a migraine usually lasts about 12 to 24 hours, sometimes less, sometimes more. A cluster headache only lasts 45 minutes to a couple of hours, but it's much more intense. It's in or around one eye, and that eye may turn red and tear. The nostril on that side may start to drip or get very stuffed up. And several other things can happen during that time that make it pretty clear that it's a cluster headache. But whereas a migraine patient would like to lie still in a dark, quiet room, a cluster patient finds that the pain is so excruciating that they can't stay still. They often rock back and forth or bang their head against their hand or on the wall. And those are the three most common types of headaches that aren't caused by other more serious things. Of course, an occasional patient will have a headache caused by a much more serious thing like a brain tumor or meningitis, which is an infection in the brain, or head trauma where you bang your head or have a car accident. So that's pretty much what headaches are about.
You mentioned being a part of the development of several medications and devices to combat headache of varying types and severity. Talk about GammaCore. It's the first non-invasive device designed to alleviate some of the pain caused by varying types of headaches. Is this something that you are a part of developing as well?
Yes, we were in the first GammaCore study for cluster headache. It's an ingenious device which is just placed on the neck, and it stimulates the vagus nerve in the neck, and it sends electrical information up to various parts of the brain to stop a cluster headache in its tracks. The only medication approved for cluster headache before GammaCore came along was a sumatriptan injection, and it does effectively stop headaches pretty quickly. The problem is people with cluster headache, even though it's only about an hour long in duration, it can occur 3 or 4 times a day, many days of the week, and it can go on for 3 months or so before it goes away just the way it started. And you can't take that much sumatriptan, and the insurance companies are very skimpy with the amount that they give you, so you can't even get that much, and it's rather expensive. So GammaCore has really been a tremendous advance because once you have this device with you, you can use it at any time. And in the United States, GammaCore has just recently, I believe in July, been approved for the acute treatment of cluster headache. So you put it on your neck and you turn it on and you ratchet it up so that it's nice and strong, and you use it a few times in the first 5 minutes to knock out the cluster headache. And it has a very high degree of reliability. In England, it's actually approved not only for the acute care of cluster headache, but to prevent cluster headache, and it's even approved for the acute care and the prevention of migraine, as it is in some other countries in Europe. So the company, electroCore, is working on a very big study now, a double-blind, placebo-controlled study, which will be finished within the next several months, and we're all hoping and expecting that the FDA will approve GammaCore for the prevention of cluster as well as the acute care, and for acute care and prevention of migraine, because it has been approved in other countries. So we're very excited about it. It's taken a few years to develop it. And I should just mention that before it came along, there were people that thought that stimulating the vagus nerve in the neck was important, even for epilepsy. And what they would do is they'd operate on the neck, open up the tissues, and tack the electrode down on the nerve. The exciting thing about GammaCore is you just put it on the neck. It's not dangerous. It's very safe. And it can be used at home, in the office, probably even in the car, but I would hope that a patient would pull over to the side while they're using it.
Now, where can we learn more about GammaCore and electroCore and much more about the development of more devices by this company.
And of course, you could Google ElectroCore, which is the company, and there'll be a lot of material there. And you could just Google GammaCore or acute treatment of cluster headache. And so that would be the best way. There's probably a more direct way, but I don't actually know how to do that, and that's the way I find out more information. Now, there are some journal supplements and journal articles that have been written, but they're more for physicians. But I bet if you Google it, you'll even find the more medically oriented articles, and that's the way I would do it.
Great. Well, I appreciate you coming in and speaking with us today, Dr. Rapoport. I'm hoping you'll come back in the future and speak with us again.
I'd be glad to.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.